It is 10 o'clock, actually 10:01, and it looks like we have a pretty decent amount of people on the call. So we'll go ahead and get this started. Um, I believe that Lisa Oswald would like to give a brief introduction before we get started. So, Lisa, if you're on the phone, I'll go ahead and kick it over to you.
Sorry.
Oh.
I can't get on from my office.
Fine.
Okay.
We just started, so Lisa actually is going to be in with us here. So.
Hi, I'm sorry. I have technical problems, probably from the user. Is everybody on?
Yep.
Yes.
And we're ready.
Well, I just have a few minutes, so unfortunately I have to head somewhere else. But just wanted to say welcome to the Provider Quarterly Call, and I'm really excited. I think I don't know, probably several months ago, Dirk and I had talked about the idea of having guest speakers on the call just to help provide support. There's just so much going on with all the different with all of you guys, and we just wanted to be able to provide support any way we could. So we have had an idea of having guest speakers. So today we're fortunate, we have two guest speakers, and I'm excited about that. So I wish I could stay in for the call, but luckily I think this is recorded, right, Dirk? Yeah. So I can be able to listen in. So, and then I know I spoke to many of you at the last city meeting, so I don't have a lot of updates, just to let you know, unfortunately, the funding that the legislature, they were looking at the JAC was looking at for the budget has been reduced. I'm not sure where it stands now. Is it $400,000 or $500,000 to be spread across WISE and WSSB? They did cut out the ADRC funding, which I think there was just a lot, quite frankly, I think there was some confusion. I wasn't asking for additional funding and to be taken from that, from the funding for WSSB or WISE. I was just looking for the funding that had been cut from my budget several years ago. I was just wanting that to be reinstated at half that. So I think 400 had been cut during the budget cuts. I was looking to have that 200 put back in so that we could have someone in-house. Hi everyone, sorry to interrupt, but quick reminder, please remember to mute your lines. That helps us do feedback. I see that there are a lot of lines not muted. Please go ahead and do that. Thank you. Sorry, Lisa. That's okay. So anyway, so I think there was a little confusion about the ADRC funding, the intent of it. It was a long shot, quite frankly, to try to get this in a supplemental budget request. So I will be asking for funding during the next budget cycle, and just really trying to be careful and clarify that this is not money. This was money that was once in the aging division budget and was reduced by 400,000, and I'm just wanting 200 to try to do this. We get calls. I know Jeannie was just one person I talked to about it. But we get calls every single day, numerous calls, as people just don't know where to go for resources. And the more that we could have someone, I feel very strongly that if we have someone that can really man that phone and that website at least 5 days a week, 8 hours a day, the more it's going to push those valuable services, get people in the right area, get the services that you all deliver, get them connected with that individual. I just feel very strongly about it. So we will be looking at trying to ask for that funding again, and also look for additional ways to fund that. There might be grants that I'm not aware of, and we'll be doing some research this next year to really try to get that out there. We feel like it could be utilized not only to push individuals to senior centers and to other providers, but also just to help them with their long-term care planning so that they can stay in their home and their communities longer. And that's why we can't do it. I don't think any of us are really experts we're experts in our field, but we're not experts in other parts of long-term care. And so we'll just keep working on that. Someone once said, I'm like a dog on a bone, so we'll get it some way. But with that said, we hope that the rest of the funding that they are looking at will go through for you, WSSB and WISE providers. I think that will be great. We know more money is needed out in the communities to serve older adults. So direct care services or money is always needed and appreciated.
And then I don't know if I have anything else really for this group. Do you guys have any questions for me? Awful quiet, but they're all on mute because Heather made them. So, but if you have any questions, I know I've had some conversations about folks who were interested in the CNA apprenticeship program, and we'll be having some meetings about that. That is definitely up and I'm pretty happy to say is up and running, and we still have to flush out some issues and work through some nuances, but I think we're going to be good to go. So that's exciting. But if you have any questions for me now or later, just let me know, and I'll be happy to answer them. But thank you for joining the call. And, I'm sorry, Dirk. I have one more quick thing. LCCC, Laramie County Community College, has been in touch with me, and they are finalizing the curriculum for the nonprofit certificate. And so once I get that finalized information, I will be happy to share it to you. And I think it's mostly going to be online, which I'm super excited about. Because I said to LCCC, we cannot ask the directors to travel extensively for these. They're too busy. So anyway, thank you everybody, and have fun on your meeting, and enjoy our two guest speakers. Thank you.
Thank you very much, Lisa. And as always, it's really nice to hear from you.
Thank you. It's nice to hear back. No one spoke, but it's always nice to hear back from everyone.
And then I'm just going to give a brief intro before we get into the guest speakers. Just a couple things that are happening overall at the aging division right now. We are turning in, actually last week, we turned in our federal report, which includes pretty much all of the information that goes into the programmatic specifics on each of the programs for Title III. That's been in, and I've been contacting several senior centers this week, asking if there's anything that changed over 10%, we have to provide an explanation to the federal government of just why something like that happened, and those are pretty easy explanations most of the time. So if you do get a call from me, that's probably why I'm calling this week. So just give everybody a heads up. The second thing I wanted to touch on is actually the contracts for the state fiscal year. Jeff will get a little bit more in depth for the WISE contract, but we're already starting to generate the templates and sending those into the AG's office, trying to get them out within the best time as possible. Obviously, a lot of this still, we can't really formalize anything until the legislature has formalized the budget for the year, but we're definitely putting those in place and getting everything out the door. Jeff will tell you a little bit more of the process in general, but please look for the WISE grant applications to come out somewhere in the first 2 to 3 weeks of March. So it'd be the second or third week of March, sorry. And that's when we're planning on releasing the WISE grant applications, or really the bid proposals for the new year. Then finally, just as a quick reminder, WSSB is having their next meeting March 14th. That's in Casper. I just wanted to make sure everybody knew that. That being said, that's it for the quick introductions that I had. And I'm going to turn it over to Jeff Clark, who's going to give a brief introduction for our first guest.
All right. Hopefully you guys can hear me okay. I'm coming in from Lovell today. Not many people get to have an in-person CLS person in their office for these quarterly calls, so these guys lucked out up here. But to introduce our first guest speaker today, we've been contacted by Tara and Ann from the Elkhorn Valley Rehabilitation Hospital in Casper, and they wanted to share with all of our providers what services they offer here in the state and how they can potentially help reach the vulnerable populations that we cater to in the senior centers and in some of the other hospitals. So Tara and Ann, if you're out there, I think this would be the great time for you to go ahead and share your presentation over the Zoom platform. Hopefully we don't have too many difficulties with that. All right, looks like we're going with that. So I'm going to go ahead and leave it to Ann and Tara to explain their service to everyone and give their presentation. Thank you again for being on the call with us today.
Thank you. Can you hear us?
Oh, wait. No.
Jeff, can you hear us?
Hello.
Quick reminder again to everyone, if you're not speaking, mute your line. We're getting a lot of feedback. Thank you.
Hello, can you hear us?
We've got you. Yes, thank you.
Oh, good.
Okay.
We thought it wasn't working. Okay. Good morning. This is Tara and Ann, and we are from Elkhorn Valley Rehabilitation Hospital here in Casper.
This is Ann. I am the director of marketing and development. Sarah Brown is our clinical liaison. And we just like to share with you information about Elkhorn Valley Rehabilitation Hospital, our inpatient program, and our home program. So Elkhorn Valley in 2009.
Hi, ladies. Sorry to interrupt. If you have the sound on both your computer and your phone, if you could mute one or the other, I think that might help. It's a little bit hard to hear y'all.
Okay, and we only have it on through our computer at this point. So I'm not sure how to make that any better.
You're coming in fine now. Thank you.
Okay, all right, good, thank you. So anyways, we are hopeful that the majority of you have heard about our rehabilitation hospital here in Casper. We have been here for 11 years now. We are an acute care inpatient rehabilitation hospital. So some people will think that we're a nursing home at times, but we are not, and we just like to clarify that we are a hospital. I think a lot of people are familiar with us for patients who are in the hospital and then transferring to us for intense rehabilitation. But one of the programs that not everyone is familiar with is our ability to accept patients from home. People do not have to be in a hospital. People do not have to have a 3 midnight stay. Because we are a hospital, we can admit patients from many different venues. And the reason why we had reached out to Jeff to talk about this is, our understanding is your home cares are going into people's homes all across the state, and your goals are to try to keep people at home and safe for as long as possible. Excuse me for just a moment. For some reason, now that our audio is working, our PowerPoint is not working. So this is the only slide we have at the moment. Please forgive us for that. Anyways, so your home care are going into people's homes across the state, and you guys are doing a fantastic service for all of your communities. But what we wanted to talk to you about is when your staff starts to see someone having a decline, you are welcome to call us to a decline. You are welcome to call us, and we have liaisons that cover the entire state of Wyoming, and we even go outside of Wyoming. And we can do evaluations to see if patients meet inpatient criteria to come to us. And so our goal is always to bring patients in, help them reach their maximum level of independence, and safely get them back home with the community resources they have. So that is what we do. We do not have to have a physician referral to us in order to do a home eval. A person can refer themselves, their family can refer them, home care can refer them, home health can refer them, anyone can refer them. And in our wonderful presentation here, there's contact information for that, but we will get to that. Can you guys see anything on the PowerPoint here?
We're viewing the inpatient rehabilitation slide. We can see that, yes.
You can see that. It seems to be stuck on that.
Yeah, I wonder, does Jeff have the ability to advance on your end, Jeff?
No, not currently.
Okay, well, we're going to try to remedy this. Tara definitely.
It looks like it's changed, yep.
Okay, as Tara touched upon home evaluation. Oh, okay, here we have another slide.
Yes.
Okay, so bottom line is Elkhorn Valley, we do follow Medicare requirements, and that is regardless of the patient's payer source. And for that, it means that people need to have an expectation of practical improvement, and they're receiving medically necessary rehabilitative services that do require around-the-clock availability of a nurse and or frequent assessment intervention by a physician, and require coordinated multidisciplinary care, so physical therapy, occupational therapy, and speech therapy, and do require intensive level of that therapy. So all of our patients do receive a minimum of 3 hours of therapy a day. And that is what separates us from the different levels of care. So in receiving that intense therapy, our average length of stay is 14, 15 days, because our goal is to provide that intense therapy, medical treatment, oversight to allow the patient to return home sooner than if they were to go to another level of care.
And let me just expand on this just a little bit more. I don't want someone to think that, oh, they have to be able to get up and walk for 3 hours a day. That is absolutely not what this looks like. We are looking at, most people are going to need occupational therapy and physical therapy. Occupational therapy is going to work on their activities of daily living. So just an example, our occupational therapists may come in the morning, help them get out of bed, get dressed, take a shower. That could take an hour of therapy right there. So, I mean, we've had patients 102?
Yes.
Patients to the age of 102. And I believe our youngest patient was 14?
Yes.
14. So we work with all different age ranges. And as far as needing to be seen by a physician every day, I mean, it is my job as the nurse liaison when I assess these patients to see what those medical needs are. Sometimes it's as simple as they're diabetic and their blood sugars have been too high or too low, or their blood pressure's been too high or too low, or maybe they had a urinary tract infection and they're on an antibiotic, or they were in the hospital last week for 2 days observation for pneumonia and sent home with antibiotics, and now they're not doing well at home, but they didn't have a 3 midnight stay, so they can't go to the nursing home. I mean, those are the people that are falling through the cracks. We're seeing it all the time. Or the frequent flyers going into the emergency room. I mean, all of those things I can look at, and it's my job to determine what the reason is for a doctor to see them every day.
So certainly the goals of rehabilitation are to gain more independent function, to promote safe living at the home and in the community, and certainly to improve the quality of life. So this is just as Tara touched upon, that we can certainly admit from home, assisted living facilities, or skilled nursing facilities, and also from observation status at the hospital, or any other status, inpatient or from the emergency room for that matter.
And I'll just
Will Medicare pay for these if you admit from home without a doctor?
Yes, ma'am. As long as they meet our inpatient criteria and my doctor accepts them, then we can bring them under Medicare with no 3 midnight stay. Because we are a hospital, we do not have to have that 3 midnight stay.
Thank you.
Yes, and again, it does not require a physician order. However, even if the patient self-refers or the family, we do often reach out to the primary care physician just to get any recent notes from an office visit or the home healthcare agency, anybody who worked with that patient recently that can certainly help us put that evaluation together and to look for the justification of the medical necessity and functional need.
Our job is to get as much information from their support system before they come to us. So we are prepared to discharge from us. We are handing them back their support systems. Was someone asking a question? All right, sorry. Oh, I did want to say, from skilled nursing facilities, a lot of times we see patients go to a skilled nursing facility, they use their 20 days of rehab, then they start on day 21 with the copay, and either they don't have a supplement and they can't afford the copay, whatever the situation. That comes out of a different Medicare bucket than what we come out of. So we can absolutely look at those patients. Just because they use their days at the nursing home, that does not affect the Medicare coverage for us or from a swing bed or a TPU.
Okay, so basically those folks from home, we consider those that have late hits or decline in function following a stroke or a debilitating illness, weakness or difficult recovery following injury, surgery, illness, or hospitalization, problems walking, dressing, bathing, or swallowing, family unable to meet the demands of the in-home care, and certainly those that have increased fall and back disorders. What we have here is per Medicare, they have what's called the CMS 13, though it's dwindled down more to 8. But these are diagnoses for the Medicare population that Medicare deems very appropriate for inpatient rehab. Not to disqualify any other diagnoses, but these are ones that we take a very close look at. Certainly to include stroke and even a history of stroke. Years out, but if there's residual weakness, and then you can see all the diagnoses listed here. Again, many other diagnoses considered, but these are very appropriate per Medicare guidelines.
Just 2 quick examples. For example, under the Parkinson's, someone who is at home and has been doing fairly well, but maybe has had an increase in their tremors. The doctor has recently increased their Parkinson's medication. Maybe they're having some falls. That is absolutely somebody appropriate for us to do a home evaluation on. We can justify medical necessity with those increased medications for the Parkinson's, and Medicare special preference to that. That's just one example of many.
Okay, this slide is rather busy, but in the interest of time, we'll just kind of briefly skim over. And that the continuum of care, we have long-term acute care hospitals, those where wounds or the medical need certainly outweighs at this time the functional need. Then a step down is the acute rehab, which is Elkhorn Valley Rehab Hospital, us, or a skilled nursing facility. And again, this just basically covers the physician coverage, the nursing ratio, the intensity of therapy, discharge to community, and length of stay. Just of note for our level of care, the middle column there, our goal per a rehab facility is to discharge 80% of our patients back home and home to the community, and that is to their home or assisted living facility. Really, it's anywhere except for a skilled nursing facility. We are acutely committee will need to return to or go to a skilled nursing facility, but that is how we are graded, and our goal is always to get them back home. Unique features, and we'll just kind of skim through because we have pictures. We have a very large therapy gym, aquatic therapy pool. the ADL suite, Activities of Daily Living, a transitional suite, which is technically our 41st bedroom. We're a 40-bed facility, but 41 in that this is a nice transitional suite. Multiple day rooms and state-of-the-art equipment. There to the top left, we have our nurses station that branches off into 6 hallways of patient rooms. We have a private patient room, and they are all private. The cafeteria on the top left, all of our patients are encouraged to go to the cafeteria for 3 meals a day as part of therapy. And then that's just a snippet of the therapy gym. What's not shown are just other pieces of equipment, parallel bars and so forth. In our therapy pool, this says that Elkhorn Valley has received the accreditation from the Joint Commission, including disease-specific accreditations in stroke and hip fracture, meaning that we've produced enough favorable patient outcomes as well as best practices in the treatment of our patients with stroke and hip fracture. And in fact, just last week, the Joint Commission was here to recertify us in both of those disease states for the gold seal. And then that just means that we can share with you and all others around the state the confidence that the patients are receiving excellent care. For the 11 years that Elkhorn has been open, we have been in the top 10% of all rehab facilities nationwide for each and every year that we have been open. And just to completely simplify the top 10%, that entails that our patient outcomes, the functional gains of our patients remain above the national average. Our discharge to community remains above the national average, and our return to acute care, our acute care transfer, is below the national average. We call this a profile. Speak to it, Tara.
So basically, this shows, we gather this information when a person comes in. Blue is their function when they admit to us. Green is their function when this patient discharged from us. This was actually someone who admitted with a stroke. If the entire circle was green, it would mean that this patient was 100% independent. Generally, we give information to our, whoever the referral source to us was, we will follow with cytogram. And this one was a hip fracture. This one, we're trying to be very aware of time here. Just very briefly, this one talks about, how much gain, a functional gain a person makes, the discharge to community, and actual length of stay. So from 2014 to 2018, we averaged 20 home admissions a year. And I mean, that is pretty good, but I just think that there are so many people that are not aware of our home evaluation program that a lot of people are getting lost. And then they fall in that trap of they're not safe to be at home and they don't really need to be at a nursing home. But that really comes down to what their only option is. And we just want to help people see that there is another option. And our goal is to get them back home, back to their community resources, to be safe. So that is what our education is today.
Yeah. And then Tara touched upon this earlier, just to make a referral, again, patient, family, friend, home care staff can call our main line. At that point, Tara or one of her colleagues, our other nurse liaisons, will begin the evaluation. Step 3, the decision, and that they take information and deliver that to our medical director. Again, to simplify, do they have the functional need and medical necessity to warrant inpatient rehab? And then step 4 is the admission. And most likely coming from around the state, that would be via private vehicle.
Correct. And one thing I would say to this is I have done quite a few home evaluations. I would say 60% of those home evaluations have qualified for us, 40% have. But just because I am going in, I'm meeting with the patient, I'm seeing their home environment, I'm seeing what the deficits are, there have been multiple times that, you know, I've been able to identify, you know, this patient, they would really benefit from home health. I'm not sure why they're not getting it. And I can call the doctor or the physician's office and have that discussion with them that, you know, they don't qualify for Elkhorn, but this is what I'm seeing and what can we do to get the doctor to order for home PT or whatever. So this is our contact information. You can feel free to either call our hospital or you can email either myself or Ann. We do, like I said, travel the entire state of Wyoming. And there's no charge for a home evaluation. There's no commitment for a home evaluation. You know, it's one of those resources that we'd like you guys to have on your list as an option for people. And now we open it up to any questions anyone has.
Hi, this is Jeff, and I'm just asking a question for the gals up here in Level. Wondering about early instances of early onset Alzheimer's. Can you guys, I guess, identify that and try to step in and have some sort of intervention and like that?
So, so unfortunately, with the early onset of Alzheimer's, that's not, generally speaking, those patients do not have functional need for 3 hours of therapy a day. And that's one of the criteria. We have to have that functional need, have to need at least 2 disciplines. So unless they have fallen and fractured the hip and had a surgery, or even if they didn't have surgery, but they have the fractured hip, I mean, we can look at them for that. But just for the Alzheimer's alone, that's probably not going to qualify for 2 disciplines.
Sounds good, thank you.
Well, we certainly want to thank everybody for allowing us this opportunity, and we appreciate your time greatly.
And the last thing that I would add on there is, if anyone would like any of our liaisons to come to your communities and do education with your staff that are going out into the homes, we are very, very happy to do that. And we can make those arrangements. Just, you know, send me an email and then we will figure out which fund covers that demographical area and we can get that scheduled.
This is Kathy. Can I ask a question?
Yes.
Upon release or with the case managers doing a follow-up, will there be referrals to local senior centers?
If that's where the patient wants their services to come through, we can absolutely do that. I can tell you that we've worked with Sheridan, and a lot of times we will make referrals through the home care there if that's what the patient wants us to do.
Well, thank you both. We really appreciate the information.
Absolutely. You are very welcome. Feel free to contact us if there's anything else you need to know or to schedule a presentation for your staff. And we so appreciate your time and all that you guys do for your communities.
Thank you again. Again, if anybody needs any information, the contact slide is still up. So go ahead and take that down. We're going to go ahead and move on now to our next presenter, which is the Wyoming Center on Aging. We have an enthusiastic presenter in Dominic, and he's here to give some information, and I'll just turn it right on over to him and let him take it into his presentation.
Thank you, Dirk. I think I'll probably just share the slides from my computer. That I think might be easier.
Perfect.
You can let me know if you see this. How's that look?
Yep, you look great.
Okay. Hi, everyone. I'm from the Wyoming Center on Aging. We are based at the University of Wyoming. My name is Dominic. I am the Community Programs Coordinator here. I know a lot of you know me already or are familiar with these programs. I've talked to a lot of you about these directly in person, but for those of you who haven't, definitely want to share a little bit of information about the programs that we offer to senior centers. And for those of you who are already familiar, I hope you will speak up and share some of your experiences with others as to how these programs have influenced older adults at your senior centers. So I'm not going to take up too much of your time. I do have a slideshow up here. We'll try and move pretty quickly through that. And Heather also distributed some handouts that has a lot of this information on it as well, if you're either on the phone or if you want to refer to that information after the fact. So we're going to tell you a little bit about what Title IIID programs we coordinate here at the Wyoming Center on Aging. But first, a little bit about us. If you're not familiar with us already, our goal is to optimize the health and well-being of our older adults here in Wyoming and their caregivers. And we do that by through interagency partnerships, like for example with the Aging Division, research, community education, and clinical training and services. So we really try and address gaps in all aspects of health and wellness for older adults. We've partnered with the Aging Division under our Geriatric Workforce Enhancement Program grant since 2015, and we're hoping to do that in the years to come. We just reapplied for another grant that would extend that partnership further. Some of our projects that we've worked on together that some of you might be familiar with include the Aging and Disability Resource Center website, the Our Family Journey program, which is a program for caregivers of those who have dementia. We helped organize the Wyoming Conference on Aging last year here in Laramie, and we also host the Dementia Caregiver Webinar Series, which I know some of you broadcast at your local senior centers. So if you're familiar with any of those projects, we have a hand in those. Starting in 2017, we started to contract with the Aging Division to deliver some Title IIID programs. The goal, of course, being to get those programs to our older adults, ideally with the help of senior centers. And we already have a lot of senior centers involved, and we love that. And we think they're a fantastic partner, and we're hoping to get even more on board with these programs. So what are the programs that we offer under Title IIID? There are 3 of them, and they all go under the name Healthy You. That's what we call it here in Wyoming. And the 3 programs are, first, the Chronic Disease Self-Management Program, and this is abbreviated to CDSMP. And this is a program that targets anyone who has a chronic health condition. That can be arthritis or diabetes or hypertension. It includes things like cancer, depression, anything all the way down to, your even more kind of niche, rare chronic health condition. Doesn't matter what health condition it is, but anyone who has to deal with their health on a daily basis, or for that matter, anyone who's just interested in playing a more active role in managing their own health. This is a wonderful program for them. And then the other 2 programs are kind of variations on this program. The first is the Chronic Pain Self-Management Program. And this is similar, of course, to the Chronic Disease Self-Management Program, but it targets those who are actively working to manage chronic pain. And we know that's a really big issue among our older adults, and we know that that is the driving force behind the opioid crisis in the US. So that's a really important priority for us as a center to address people struggling with chronic pain, and we know there's a need for that. And then the last program is the Diabetes Self-Management Program, and this is for folks with type 2 diabetes. And so this program is a little bit more specifically targeted towards those folks. And of course, as we know in Wyoming, there's a pretty high prevalence of diabetes. So these programs are really intended to meet the needs of Wyoming residents. A bit about what all the programs have in common. They're all created by the Stanford Patient Education Center. They've been around for upward of 20 years at this point, and they have been very extensively researched in a number of different trials and studies. Many thousands of people have participated in these studies. And what these studies found is that people who take these programs, their health improves. They feel less distressed about their health. They feel more in charge of their health and their own well-being. They go to the hospital less. They spend less time at the doctor. They spend their healthcare costs are reduced, And they also do a better job communicating with their physicians, which can be particularly complicated, as you know, if an older adult has multiple chronic conditions, for example. The program is offered in all 50 states and dozens of countries, and the Health and Human Services has designated it as a highest tier evidence-based program, which is one of the reasons we're able to offer it using Title III funds. So as you can see, this program is really widespread. It's been around a long time, and it has been proven to work. So one of the reasons we really believe in this program is that we know those outcomes exist, and we've seen those outcomes in people who have taken the program here in Wyoming. And we're really excited to be affecting older adults so positively in that way. And that's, of course, why we feel driven to continue to expand this program and make it accessible to even more of our older adults. So a little bit about the programs themselves and what you actually do in the programs. So each of the workshops, there's 3 different workshops, like I mentioned: chronic disease, chronic pain, and diabetes, and they're all called Healthy You here in Wyoming. Each of them is a series of workshops delivered over the course of 6 weeks. So once a week for 2.5 hours over the course of 6 weeks, participants come and attend these workshops. They require that between 8 and 18 participants are in the classroom at any given time, and they're delivered by 2 facilitators who we call leaders. And these leaders, they're not specialized medical professionals, although they can be. A lot of them are volunteers or people who have gone through the programs themselves who feel strongly that this is a good program and they want to help perpetuate it and reach other people with it. So leaders really are members of the community, people who believe in the program more than they are teachers, for example. And the workshops are very participatory. So kind of along the same lines, no one is teaching anyone how to deal with specific chronic conditions. A lot of the workshop is about building mutual support, people getting ideas from each other as to how they might manage a particular problem with their chronic health condition. There's a lot of brainstorming activities, there's a lot of conversation, as well as some more didactic portions where that are a little bit more like mini lectures. So it's not the kind of workshop where someone shows up and someone talks at you for 2.5 hours and then you go home and you never really got the chance to be involved. And all the programs are built on a similar skill set. They really emphasize skills rather than specific ways to deal with specific chronic conditions, because skills you can apply to anything, even outside the realm of chronic condition. So a lot of the skills we talk about are action planning, problem solving, decision making, healthy communication, and positive thinking. And again, these are skills that are good skills for anyone to learn who's dealing with a chronic health condition, not just someone with a specific one, like, for example, diabetes. So if you have a good problem solving technique, regardless of what you're dealing with at the time, you can use it to address that particular issue. So the general Healthy You workshop, like I said, is the chronic disease self-management program. And in that workshop, we cover a number of subjects, and these include ways to deal with problems like frustration, fatigue, pain, isolation, and poor sleep, problems that are really common among those suffering with a chronic health condition. We talk about appropriate exercise for maintaining and improving strength, flexibility, and endurance, because we know how important exercise is to maintaining health as we age. The appropriate use of medications, communicating effectively with family, friends, and providers, good nutrition, and then how to evaluate new treatments. And this is just some of the stuff that we go over in these workshops. And these workshops really emphasize the fact that not all of the skills you learn in these workshops are going to be right for you. The goal really is to introduce people to a variety of different techniques to handle their chronic health conditions, and then to let them choose what will work best for them, what they are most willing to do, what they find most feasible. Because if we frame it in that way, we find the participants are much more likely to do it than if they were to show up to a workshop, have someone tell them, you need to do A, B, C, D, and E to maintain your health, without them having any say whatsoever in which of those things they prioritize and which of those things is important to them. So it's really about empowering participants to identify which of these things is doable, and which of these things do you want to take on, with the ultimate goal being to improve your own health and your own ability to manage a chronic health condition. The CDSMP, the chronic disease version of Healthy U, is our most widely disseminated evidence-based program. A lot of you have already hosted a program like this in your senior centers or have heard about it somewhere in your town. We brought this program into Wyoming in 2015. And right now our network of facilitators includes 43 facilitators in 15 different counties. So the likelihood is there is a program like this somewhere near you being offered. And we offer it primarily in, like I said, senior centers. Public health is often involved in offering these programs. We're in some subsidized housing facilities, some assisted living facilities, and then some hospitals and wellness centers. And of course, we're always looking to expand the number of senior centers, which is why I'm here. Healthy U for chronic pain is the second program I mentioned. This one is relatively new to the state. Right now, we only have 4 facilitators, a couple in Sheridan, a couple in Casper, but we're looking to recruit more. Both the chronic pain and the diabetes versions of this program require our facilitators to train as chronic disease facilitators first, and then they cross-train into these other programs. So chronic pain is something that we're looking to expand throughout the state. So if that's something that you think would be particularly useful for your community or your senior center, I encourage you to get in contact with me because we are looking for new host organizations for these programs. And the same goes for diabetes. Diabetes is brand new. We've just started offering it. We've had our first couple folks train just about a week ago, and we have a lot of interest already. And again, this program targets people with type 2 diabetes. So this is, again, a new program. We're looking to expand it throughout Wyoming. And if you have a large population of folks with diabetes, or if you feel like this would be a particularly useful program to have either at your senior center or in your area, I encourage you to let me know so that we can start working on getting folks involved and thinking about what a program like that might look like in your community. So a little bit about us in senior centers. Like I said, we've been working to offer these programs in senior centers. We've had them in probably at least a dozen at this point. We do training for all program facilitators. So all the training, all the people that work throughout the state go through us. We pay for program training and we pay for all program costs using a combination of Title III funds and funds we have from other grants. So if you're a senior center getting involved in Healthy U in any capacity, there is no cost to you, and we provide support throughout the entire process. We also provide support in connecting senior centers with other local partners to help deliver the program. So if there's people in your community that already offer this program, we can work together to set up a workshop at your senior center, or we can facilitate a partnership where 2 different organizations, and an example of this might be a public health and a senior center partnership. They work together to offer and deliver the workshop. So, you know, if you're one of those senior centers whose personnel is stretched a little bit thin, or you're concerned about whether you can host a workshop like this, or how effectively you can recruit new participants, whether or not you can get enough people in these workshops, we are happy to help in that process. So what's in it for senior centers? Of course, the first thing and the most important thing for all of us is to improve the health and well-being of our older adults. We've seen how effective these programs can be. If you've delivered one of these at your senior center, you know the wonderful stories that come out of them, people losing 30 pounds in the course of 6 weeks, people already lowering their A1C values, people showing up to exercise at the senior center for the first time in years. There's some really cool things that we've seen happen. So of course, that's first and foremost in our mind. It's an addition to your senior center's programming. Another reason for people to come to your senior center, you can attract new members. The last time we did this program in Laramie, I think we had 6 or 7 people who'd never been to the senior center before, who were coming every week, who were staying for lunch, who were beginning to use the gym. So it's definitely a good way to attract new people. Every senior center that is involved in these programs and helps host a workshop gets a $1,000 stipend from us every year. And you can choose however you want to use that. So that's just money you can, that's for the senior center's discretion as to how to use it. The people who facilitate the workshops, they each receive $300 per workshop. So there's some compensation for them as well. And if they are employed by the senior center and they're doing it as part of their job, we commonly route that money to the senior center instead. So that might be a little extra benefit there. Like I said, it's free for senior centers to implement it. We cover all costs. Our goal is that senior centers pay nothing whatsoever to deliver these programs. And in turn, these programs are free for participants to attend, even if they want to do it multiple times. And it is common for people to attend it multiple times because they love the environment. They love being able to talk to other people who are also, who have similar issues that they do and get additional ideas and provide their own ideas in turn. And like I mentioned, we offer support in planning, marketing, delivering, and evaluating these workshops. So we can help you at any step of the way. Including evaluation. So we administer evaluations to everyone who takes these workshops, and we can provide you with information about how satisfied they were with the workshop, the kinds of ways that their health is improved following the workshop, which can be a great way to market these programs, to talk about the positive effect your senior center is having on members of your community, and things like that. So we are available to you for anything and everything. And to that end, we want to let you know that we have a training coming up for the Healthy You program. We're looking for new facilitators. And this is going to happen May 5th through 8th in Lander. It's 4 days of training, a full day each day. Like I said, it's completely free of charge. And we also cover all lodging, travel, and daily expenses while you're there. So again, it shouldn't cost you anything. Like I mentioned, anyone can become a facilitator. You don't need to be accredited. You don't need to be a healthcare professional. And as I also mentioned, workshops have to be led by 2 leaders. So if this is something that you're interested in bringing to your senior center or your community, we need to have at least 2 people. But again, if you are sort of hurting for staff, or if it might be a stretch to get 2 people away for 4 days, let me know and we can work on finding a partner for you in your community who may be able to help you bring these workshops to your populations. And then, of course, if you attend the training, or anyone who attends the training can then become cross-trained in the chronic pain or diabetes self-management programs, and we can start addressing some of those needs in our communities. So this is my information. This is my contact info. It's also on the handouts that Heather distributed. Please don't hesitate to reach out to me if you have a question about any of these programs. I've been working with these programs for about 3 years now. I teach workshops in Laramie. I've seen firsthand how positive the effect can be on our older adults, how thankful they are for these programs, and some of the huge improvements they make, and how happy they are and our senior centers who host them are to be able to offer these programs. So we hope that those of you who don't offer these programs already will consider becoming a part, and we hope that those of you who already offer these programs will continue to be wonderful champions for the health of our older adults in the state. And yeah, that's all I got. Please don't hesitate to reach out to me if you have any questions. And as always, thank you all for the services that you provide to our older adults. Here at the Wyoming Center on Aging, we know how important a role you play in your communities, and we're truly grateful for that. So thank you all for your time.
Thank you very much, Dominic. And as always, it's a pleasure to have you on the phone. You're just a wealth of information. Real quick, just if anybody has any questions for Dominic, we'll pause for a second just to make sure no one has any questions.
This is Bonnie from the Cody Senior Center. Good morning, Dominic.
Hi, Bonnie.
We had 2 people trained, I believe it was last year, and we went to the radio, we announced it in the senior center, we were out in the public with flyers, and we never got one person to sign up for it. And so, of course, their year has lapsed without being able to teach anyone. That's the problem I'm finding, is the course is so long, especially for our seniors. They aren't wanting to sign up for something that they have to sit that long. Their attention span, of course, just isn't quite that long. Mm-hmm. So I was just wondering, is there a possibility of maybe trying to figure out a different way to present this to them?
In terms of the length of time that these workshops take, that's something that is unfortunately we can't change. Like I said, this program is administered internationally, and one of the ways that we know it has the outcomes that it does is that it's delivered the same way in every place. So we are beholden to the program authors in terms of how long the sessions are. But we do have other ways to address difficulty recruiting people. We've started a process called a pre-information workshop session, which is a little informal gathering a few weeks prior to the start of a workshop, where people who are interested can come and basically get a little taste of what the workshop is like, which we find makes people more inclined to attend the workshop and also stay throughout the entire workshop series. That opportunity to learn a little bit before actually committing to something so long. We do have some budget for local media advertising, whether that's the newspaper or the radio. We have a number of different kinds of marketing materials that you can use to approach healthcare providers or other social service providers in your community that will help them understand what the program is. Because one of the most effective ways you can get people into the workshops is by partnering with people who have more consistent access to people with chronic health conditions. So, if you can get a couple local healthcare providers or social service providers on board, and they can send people your way, often that's going to be a sustainable source of participants throughout the life of the program. And then beyond that, if you want to contact me directly, we can think of other ways, other ways we can market these programs in your community to help address that program. Because the first program it can be a little bit difficult to get 8 people in the room who are committed to 6 weeks. And we've seen that throughout the state. So, to that end, we have a number of different resources available, and we are more than happy to help you at any point in the process. So, please use us as a resource. And those are just a few ideas. I'm happy to talk about more offline, just so we don't make this take too long. Yeah.
Very much for your time, Dominic.
You're very welcome. Thank you for your question. Melissa Clark in chat asked if we do all the advertisement for us. So generally, we make any marketing materials you would like. We have flyers and trifolds and little write-ups for the radio or the newspaper that we can produce for you. In terms of actually doing it within your community, that's something that we're a little bit less capable of just because we are here in Laramie. So more often our role is to create materials for you and to provide guidance and to help brainstorm ways that you can promote these programs on your end. And then, you guys being the local ones, the actual legwork and meeting with people face-to-face tends to happen on your end. So we do as much as we can remotely, and we contact organizations in your area remotely on your behalf. But there's a certain amount that we cannot do remotely. So we do as much as we can from where we are here in Laramie.
All right. Well, thank you very much, Dominic, and we appreciate your time and all the wealth of information that you can provide for us.
Thank you, Dirk, and thank you all again for your time.
All right, that being said, we're going to move on to the CLS program manager updates. We just have, I know we're pretty close to the hour that we said we were going to, so knowing that your timing is very valuable, we'll move through this as fast as possible. So we'll start with the C1, C2 update from Caitlin, and I'll turn it over to her.
Hi, everyone. I just have a few things. So last month I did a nutrition education training, and one thing that got brought up was having an approved list of education materials so that your RDs on your staff don't have to necessarily sign off on it every month. So I am working on creating that for you, and I'll let you know when that's completed. One other thing that's come up too, just to clarify on, is the temperature requirements for C2 meals. In the policies, I think it says that they need to be tested on intermittent, regular basis, but there's no specific time frame. And I just wanted to clarify that we got guidance from the federal liaison that that's not a daily requirement or a weekly requirement. It's basically just every quarter or every month, and you can just leave that to your discretion. You can get reimbursed for those test meals, and Jeannie's currently working on creating a subservice in SAM. So we'll let you know when that's available, and then I think Heather's creating a video on how to enter that into SAM. So you can get reimbursed for those meals, but again, we're just limiting that to one reimbursement per month for those. And then the next thing is that I have a couple of things I want your feedback on. I know in the past that the cooks training was done within our division, and we're looking at possibly doing something similar to that in the future. So please be looking for a survey that I'm sending out, and if you could take the time to complete it, pretty short and sweet, but just so I can gather information on what would be helpful for you. And then the next thing is that I'm looking at redoing menus and recipes possibly in the future too. So if you have any suggestions or ideas on that, I would appreciate your feedback or input. I know a couple of you have reached out to me about that, so if you have any meetings on it through Velocity or stuff like that too, that I could be included on, that would be helpful for me as well. That's all I have. I think next we have Jeannie, and she's doing the B program because Betty is gone, so.
Hi, everyone. Hey, the Title III-B, you all did lovely this year with not entering aggregate counts in services that shouldn't have aggregate counts. So the big thing is that we just want to make sure that the only 3B aggregate count is for public information newsletters. So you put one unit for that newsletter, and then if you think it reached 10 million people, then you put that in the consumer served, okay? The groovy part is that Betty, every quarter now, is going to start to look at your SAMS reports and make sure that we are entering it correctly. So then that way in December and January, we're not calling you all and asking you all to fix things. So that's a really, really good thing also. Also to remember, there is that aggregate 3B SAMS report that if you've done a newsletter, you'll need to run that report along with your 3B report. Okay, and the difference is the 3B report has the age 60 on it, the aggregate does not. Any questions on that? All right, groovy. We're going to go now to caregiver. Well, actually, it's caregiver and 3B. This is regarding the quarterly financial reports. Please remember that they have to match your monthly invoices. That's for both 3B and for 3E caregiver and older relative caregiver. And the lovely part is that we no longer have quarterly program reports for caregiver or older relative caregiver, but you still have to send in your SAMS quarterly reports with the financial report. We would like to thank you all for the monthly caregiver and WISE waiting list. You have been doing splendid on that also. And then the other thing I'm asking, begging, pleading with you all is for the federal report that Dirk was talking a little bit about. We still had 44 caregivers and 4 older relative caregivers relationships missing. So what I'm going to ask y'all to do is to go back and check your caregivers and your older relative caregivers relationships, and really we're going to shoot really high for the federal fiscal year 2019 federal report. We're going to go 0 and 0. We're going to do the 8s, okay? If you have questions about that, please let me know and I can sure help you with that. Now on to another lovely thing. Wendy, I'm sure you're excited about this topic. It's the SAM registration renewal or System Award Management. We've been sending out emails regarding this. As soon as you get the email, everyone, I'm begging you again to get started on it. because sometimes it can take a little while. So I just wanted to bring that up because that is a big, big deal. Questions?
Well, thank you, Jeannie. And remember, SAM is different from SAMS. SAM is your registration required in order to get any federal money under a federal grant. So just highlighting the difference there. We'll move on to Jeff now, who's going to give a quick WISE and quality assurance update. Jeff?
All right, thanks, Dirk. All right, so just a couple things today. We're going to start out with WISE. With that one, I don't have any big updates except for wanting all of the WISE providers out there to kind of be ready to start gearing up for the WISE grant application. We are waiting for the legislative session to come to a close, at which point we'll have final numbers that we can run on our end, and hopefully within about 2 or 3 weeks of the close of the legislative session, have the grant application out to all the providers. We're definitely looking at streamlining that process a little bit this year, always trying to make things easier for you guys. And that is the only update I had for the WISE portion today. On to the quality assurance updates. Currently, I've been sending out invitations to our providers to take part in their annual quality assurance review, either through a desk review or an on-site review. I've currently reached out to about 1/3 of our providers at this point, so if you haven't heard from me yet, I do anticipate getting in touch with everybody by the end of May to schedule some form of a review this year. And if you haven't heard yet already, or if you haven't taken part in anything with me yet this year, we are bringing that over to an electronic process, an electronic format through Google. Moved all of our questionnaires over to Google Forms, which has been really, really exciting for me. Being able to capture the information in this electronic format gives us a way to easily compare information about the centers that we deal with. Also allows us to quickly grasp key information that we might have questions about regarding all of our providers. So this, I think, has been a really big benefit to have this information in that format. Also, being able to share files through the Google Drive file pretty much seamlessly back and forth. We hope that this won't only just be an improvement for the review process, but also hoping that we can utilize this information in other areas of what we do with the granting and contract processes. So other than that, that kind of takes care of that part. The only other part in the QA section that I wanted to bring up is a new practice that we've been doing in CLS since the beginning of October, and that is sending out delinquency letters. As you all know, we have certain deadlines for each of our monthly invoice reports, our quarterly reports. There's a handful of documents that we ask for under the Title III-C program that are required each year. With that, we have been tracking those, and anything that's coming across our radar as beyond 30 days past the due date of documents, we are sending out really just a reminder letter to the directors to allow them the opportunity to say, hey, we have documented that these requirements are past due, and we would like you to address them as soon as possible. And for our purposes, it really just comes down to being able to document our efforts in getting these requirements taken care of for each of our providers. Also helps us see where we might have bigger issues out there. The reason for this is we had a pretty big uptick at the beginning of the year of documents that were coming in beyond that 30 days past due. And so we needed a way to capture that information and also provide a good source of our tracking and trying to correct the issue in the best way possible. So again, if you happen to get one of these letters in the mail, know that these are meant to be a non-punitive correction, but just that they're out there so you have a reminder, we have documentation that we're trying to correct the issue. And unless you have any questions, I'm going to pass this one on to Heather.
Great, thank you, Jeff, and thank you all for hanging in here as we go a little bit over time. I just have a couple of quick reminders and updates. My first is that for SANS users, if you are updating fields on SANS reports that we provide to you, please do not save changes. I make it a note to update those reports at the beginning of every month so that the date ranges are correct. If for some reason you're going back and running them for previous months, you're absolutely welcome to do that. But again, please do not save the changes. The next thing, we've received a lot of revisions of both monthly invoices and quarterly reports in the recent past. So I would ask that if you are submitting revisions, especially if it requires multiple revisions, please do submit that to the correct program manager first. And then the program manager will sign off on it and let you know that, and then you can submit it to WDH CLS payments. We're just having an issue tracking all the number and the different versions that are coming through. If you have questions about that, please don't hesitate to reach out to me after or any of the program managers. Just want everyone to kind of be on the same page about that. Next, if you are submitting a revised invoice, either monthly or quarterly, it must have that it is revised in the comments. You can type that in, you can handwrite that in. Just please let us know that it's revised, again, so that we can track different versions, as well as a different date than the original submission. So please take a look at that and remember to do that. That just helps us so much in the tracking process. And because I check that central email address and distribute it out to the program managers, that just makes everyone's life so much easier. Finally, talking about submitting invoices and monthly reports and quarterly reports in general, please make sure that you're scanning those incorrectly. Sometimes when we receive them, they're much smaller than they are if you just scan them in at size. So we're having difficulty printing them. They come out kind of grainy. So if you have questions, again, please don't hesitate to reach out to me. But just making sure that those are coming in the correct size so that we can get them printed out and out to the program managers as quickly as possible. And that's everything that I have, so I'll hand it back to Dirk.
Well, that is the total update. We tried to do this as fast as possible. I'm sorry that we're over by 15 minutes. I'll open it up now. If anybody has any questions, please let us know, and we'll take a few minutes here of your time to just open it up for questions. All right. Well, hearing no questions, we'll have this quarterly call come to a close. I believe Heather already has the next quarterly call scheduled. Do you have that date with you?
I do. I don't have that date on me, but I will send out an email after this to remind you of those quarterly call dates, as well as soon as Zoom is done compiling the audio of this call, I'll go ahead and get that posted to the website. So once I've done that, I will send out an email to all of you to let you know that, and as well as give you a reminder of the future call dates so that you can pencil those in.
All right. Well, thank you all for your patience, and lovely to have everybody on the phone. We'll see you next quarterly meeting, and thank you again.